Keynote. These are some essays that were selected for our journal, but they won't be speaking today. So we'll go back to the slides so you can have a look, and you'll be able to access our journal after the conference. These are some of the speakers today. These should be on your running orders. And these are our keynotes. So we'll get started. Our first speaker today is Kimberly Jamie, who's talking about teenage mothers' health and well-being. Thank you.
Yeah, lovely, thank you. Well, hi everyone. Thanks so much for inviting me. I mean, I'm so impressed by the conference, by the running order, the organisation, and the number of absolutely fantastic papers that we've got to look forward to today. I think that if academic conferences were run and organised in the same way that this one has been, I think the world would be a better place, to be honest. I'm really sorry that I can't stay all day. I've got board of examiners, and you know, as a sociology student, will be happy that I'm going to that rather than staying here, because otherwise your marks would be delayed. So thanks ever so much for inviting me. My name's Kim. Please don't call me Kimberly. Only my mum calls me Kimberly. It freaks me out a little bit. And I'm a lecturer in the School of Applied Social Sciences. My work is in the area of medical sociology primarily, but I also do some work around sociology of work and professional identities. I'm going to be talking today about a project which is around about halfway through at the moment. It's only a one-year project, and we're kind of around about 6 months into it, which is sponsored by Cancer Research UK, and it's about the everyday lives of teenage mothers, particularly kind of health and well-being, decision-making and understanding. I'm leading on this project in the North East, but I should also say a really special thanks to Hannah Bowes, who is the research assistant on the project, and who, to be honest, is really driving it, because I'm the research lead, which means that I sort of hand everything over to her, and I go and hide in my office and do teaching and marking and all these types of things. So, I mean, you know, Hannah's absolutely fantastic, and unfortunately she's not here, but a great deal of thanks does go to her. So, this project's sponsored by Cancer Research UK, and you're all sitting there thinking, why are Cancer Research UK doing a project about the everyday lives of teenage mothers, right? So let me give a little bit of context for this. What Cancer Research UK know for sure is that almost half of all cancers are attributed to some kind of lifestyle or behavioural factors. They've got a really fancy kind of image here which shows the main risk factors in developing cancer over the lifetime. And of course, unsurprisingly, tobacco and smoking is the biggest one. Now, these types of risky behaviours, what medical sociologists know, are that they're culturally and socially located. And what that means is that people don't smoke because they're too stupid to not understand the stuff about lung cancer. They don't smoke because they don't give a shit about it, right? They smoke because there are particular cultural and social, familial and relationship environments which lead them to smoking, right? So if your family smokes, if you come from a particular culture where smoking is really quite normalised. And also what we know is a study done a few years ago which said that single mums actually smoke a lot across the sort of ages, smoke a lot more than would be expected, because actually nipping outside for 5 minutes to have a cigarette is a chance for them to get away from their children, right? They put it in much nicer terms than that, of course. So we know that these are socially and culturally located. It's not a case of not caring or not understanding. Now those people in what are often termed hard to reach groups, and I'll put that in inverted commas, are more likely to engage in these risky behaviours, right? Now what we mean by harder to reach is people who don't engage as actively or as enthusiastically with kind of the big sort of institutions in society, with kind of education, healthcare, local government and things like that. So what we're talking about is people from certain age brackets, people from certain socio-economic groups, people in deprived areas, recent migrants, certain ethnic groups, for example, are generally called kind of harder to reach because of this general sort of sense of disengagement. But if we're developing, if Cancer Research UK are developing a kind of message, a health message, a stop smoking, lose weight, do more exercise, drink less alcohol message, what they know is that these messages don't work universally. So having one message which goes out to everybody isn't going to work. That these messages have to be adapted and tailored. What Cancer Research UK say as an example of this is that when they put out material about stop smoking, for example, when they use the notion of passive smoking and show a child kind of, inhaling or its parents smoke, that works a lot more effectively on people with children than without children, and of course that's hardly surprising, but it's an example of the fact that this sort of universal approach doesn't work at all. So what this means is that to understand how to target health advice messages to particular harder to reach groups, to particular populations, we need to understand the very particular local cultural context into which these messages are going to be absorbed and going to be understood, in which these particular behaviours take place, right? That's kind of a broad context. So Cancer Research UK then are interested in harder to reach groups, because generally these harder to reach groups are much more at risk of engaging in sort of risky behaviours. Generally they're much more at risk of presenting symptoms of cancer much later. They end up having a much worse experience and ultimately costing the NHS a lot more money. So Cancer Research UK's approach is kind of prevention rather than cure. So if we can prevent these particular groups getting cancer in the first place, that's going to be a lot better than sort of throwing money at a cure which potentially is ineffective because it may be too late. So what Cancer Research UK did was they hired out a hotel in Oxford last year, and they got a whole bunch of researchers from a whole diversity of different academic backgrounds together to address this problem. And what they said was, we want to target cancer research and cancer prevention messages in harder to reach groups. You're the researchers, tell us how to do that. And this group of researchers we'd all never met before. We all got together in this hotel in Oxford, and we formed little working groups and kind of little groups of people based on shared interests and shared methodological approaches. And we all then had to pitch a project to them about a particular harder to reach population that we were interested in. So I teamed up with these two lovely ladies, Lucy and Roisin, who are from Bristol and Belfast. And we pitched this project about teenage mothers, and we were fortunate enough to get the funding awarded. So teenage mums then are often conceptualised as being a harder to reach group. Again, always problematising this notion of harder to reach. They're generally at elevated risk of smoking, poor diet, high alcohol consumption levels. They generally live in deprived areas, in poor housing conditions, low educational attainment, etc., etc. All of the sort of usual characteristics that we would associate with a kind of harder to reach and at-risk group. The issue for teenage mums is that policy and practice tends to focus on the children of teenage mums. So the kind of medical gaze, if you like, as soon as they have children, shifts onto their children, whereas the mums themselves may well be 15, 16, 17 years old, are, we might argue, still children themselves, but the medical gaze kind of loses interest in them, really, and shifts onto their children and their children's outcomes. And teenage mums really kind of fall down the cracks of a lot of service provision. They are teenagers, so services tend to be kind of aimed at teenagers who aren't parents or parents who aren't teenagers. And there's not much that kind of meets in the middle for teenagers who are parents, for parents who are teenagers. There's not many services which bridge both of those kind of worlds that these women are occupying. And so because of that, they tend to kind of fall off the map, they tend to sort of disengage a little bit and therefore become harder to reach. So Cancer Research UK then, what we're interested, if they were going to develop a kind of intervention, so some kind of training, some educational materials, some sort of course, some sort of promotional literature that would actually work for this group, that would actually get them to reduce the amount that they smoke, maybe take more exercise, have a healthier diet. How would that actually work? How would that be successful? We don't want an intervention which is paternalistic and which comes kind of top down and says, we know this population, here's what's going to work for them. It has to be bottom up. So as researchers, as qualitative researchers, we said, well, let's ask this harder to reach group then. Let's engage in a conversation and see what would work for this group. So in order to do this then, we felt we needed some kind of innovative methods. We didn't want to just go out and do kind of interviews or you know, fill in a questionnaire. That's quite boring, it's quite disengaging. So we are recruiting up to 60 mums under the age of 21, 20 in each of the 3 areas, so Bristol, Belfast and the North East, corresponding to where the researchers are from. What we realised is that this was hugely ambitious. They are a harder to reach group. They are hard to engage in research. We said initially that actually it was fine if we only got half this number, if we only managed to get 30 participants, so 10 in each area. We've since then adapted that again and said actually we're fine if we only get 7 in each area, because this group is really so difficult to engage in the research process. But we're still recruiting and you know, we're still ploughing on with it, and that's okay. I keep telling myself that's going to be okay. The way that we're recruiting is through children's centres and third sector organisations in the local area. So in the North East, that is in Stockton, Thornaby, Durham and Middlesbrough, and then of course Belfast and Bristol have their particular areas that they're recruiting in. We're displaying posters in these spaces, and we're sending out flyers directly to the women to invite them to participate to get in touch with us and say that you know they're interested in participating in the research. What I would say is that, you know, I said we need an innovative approach. I'm aware that all of that is fairly standard, right, and it's fairly kind of normalised and standardised and potentially quite boring stuff. As a kind of disclaimer, the project's a year and it has a very limited budget. There are a number of different recruitment methods that I could absolutely see working, which we just don't have the time or the money to do, which is a real shame. We can come back to that at the end if you want to. So for data collection, and this is where we're trying to be a little bit innovative. We're doing photo elicitation with the participants. We're giving them a disposable camera, which is quite depressing because some of them have never seen a disposable camera before because they're so young, and it just kind of, you know, hits you like a ton of bricks, actually, your own ageing process. And we're getting them to go out for a week and to take photographs which represent a typical week in their life, hence the title of the project, A Week in Your Life. And what we say is we don't want staged photos, we don't want selfies. There are a set of norms that exist around taking pictures, and what we're saying is try and get outside of that. Try not to have posed pictures, right? So the example that I use is that, you know, I live in York and I work in Durham, and I'm sometimes over at the Stockton campus as well. I spend an inordinate amount of my life on trains or on the bus between the Durham and Stockton campuses. So if I was doing this, there would be more than one photo in there of some kind of train or bus or public transport, because I seem to spend so much of my time in these places. So that's the kind of example that we give, right? And then we invite the participants to a focus group where we have the photos out and we say, well, tell us about these photos. What do they say about your experiences and your life, your everyday life as a teenage mum? Where do you go? What do you do? Where do you not go? Who do you talk to? Who do you rely on for support? Who doesn't support you? And they're not particularly structured conversations. It does just end up as a group of women kind of having a chat, really, which is great. Then the researchers go away and kind of analyse that data, and then we invite them to another focus group where we say, this is what we think we found, this is what we think you told us, but have we got this right? Is there something in here that we've kind of missed? And crucially then, moving it on to the next stage, if for Cancer Research UK we were going to develop some kind of intervention, some kind of help for you to become healthier, how would that look? From the data that you gave us, this is what we think. But actually, have we missed the point here, or are we kind of along the right lines with this? And again, you know, we have really useful, fruitful debates with them about this. What I want to do is move on and present some early findings from this research. Now, I want to sort of put a bit of a disclaimer here and say that this isn't an explicitly gendered project. This wasn't ever set out to explore the particular gendered experience. When I was asked to present at this conference, I thought, wow, this is a real opportunity, actually, to look at my research data in a very different way. Because what it seems is that, what I realised is that the project is implicitly gendered. It's about mothers, it's not about fathers. We're not interested in teenage parents, we're interested in teenage mothers, their particular experiences. And when I looked at the data through these kind of fresh eyes with this sort of gendered framework, actually these women's experiences are hugely gendered and tell us a hell of a lot, not only about their experiences of performing a particular type of gender, a particular performance of motherhood, but also tell us a lot about gender and expectations of gender roles more generally. And I hope that I can kind of bring that out. These are very early findings, they're very early reflections, and I would love to have a discussion about these more than presenting them as kind of, this is the truth and this is what we're publishing. Right, so first of all, one thing to say is that all of our participants considered terminating their pregnancy. This is something that really struck me in the interview data. They were all very, very open about that they discussed it without much prompt, very, very openly, and in a very, very sophisticated way, drawing on what we absolutely would recognise as feminist frameworks about the nature of life, about the timing of life, about women's rights to their own bodies, rights to choice and things like that. These are women that haven't had any kind of formal training in feminist methods or kind of sociology or anything like that, yet are drawing on discourses that we absolutely recognise as being within these kind of feminist frameworks. What they noted was this idea that when they told people that they were pregnant, they experienced this kind of simultaneous pulling away and pulling close by friends and family members. Because of the sort of non-normative way that they were doing motherhood, they were young, they weren't married, they were still living with their parents, children born out of wedlock, heaven forfend. Some people actually couldn't handle that, and some of their friends and family felt that sort of non-normative approach was really a little bit too deviant for them, and they really pulled away from the relationship and from the friendship. What I think is more interesting is the people who pulled close to them. The women spoke about their experiences of having much more intense relationships with people. They spoke about becoming kind of revered, really. Their children were seen as kind of playthings to be shared around the group. All of their friends wanted an afternoon looking after the children, take the children to soft play, take them to the park. They did become a real plaything. But also the women themselves became quite revered. They were the first ones of their peer group to kind of take this step into parenthood and take the step really into kind of womanhood, to move their sort of performance of being a woman onto sort of the next level, as it were, which none of their other friends were doing, and moving into these kind of uncharted waters. Nonetheless, what happened, whether they are pulling away or pulling close, what is happening is that the women's choices and the women's bodies are, I think, becoming a matter for public consumption. Their choice to take this kind of non-normative route into motherhood was being judged by people as whether that was right or wrong, which then led people to pull away or pull close. And I think this kind of public consumption and the sort of moral questions that raises, I don't think it's something that we see, A, with fathers, and B, with women who are a little bit older, actually, mothers who have children a little bit later in life. With the women that, with the friends and family members that pulled close, what we see is a development of kind of key allies. Generally these were female members of the family, usually the mum, but otherwise the partner's mum, so the kind of mother-in-law, if you like. This perhaps isn't particularly surprising, but what I found most interesting was the kind of ties that bind these key allies to the women. They spoke about their kind of shared experiences of gender. We're both women, we both understand this, and the shared experiences of motherhood. And I think the shared experiences of gender is really interesting because it's kind of on multiple layers, because the women spoke about, we have this shared experience of being pregnant, of giving birth, of breastfeeding, so this very kind of physical shared experience, but also there's a sort of shared experience around expectations of womanhood, and participants went through this kind of process of socialisation where their female key allies really taught them how to become very traditional women. So they helped them to look after the children and how to kind of do the childcare stuff properly. But also there was this sense that they were being taught how to run a house, how to kind of keep on top of the housework, how to do the shopping, how to kind of look after the male partner. And this was just absolutely fascinating because these women were kind of, just really slotting into these very traditional gender roles, which had been absolutely sanctioned by the key allies within their family really, really unproblematically. And that for me was you know, a really, really fascinating finding. And so there's this kind of constant renegotiation of these sort of boundaries between their mums becoming grandmothers and they themselves becoming mothers, and the sort of identities that people have within families and within friendship networks really do shift and change and become a little bit unstable. What I want to focus on is one of the big topics which came out, one of the big themes which is quite clearly identified in the data, which is this idea of judgment and surveillance. All of the women felt judged, universally, from a number of different directions: friends, family,